Hi, everyone. Welcome to another episode of Ascend TV. I'm your host, Dr. Leslie Cadet, board certified in occupational and environmental medicine, and the founder of Ascend Occupational Medicine Consulting, where we help self-insured employers lower their work comp costs through medical oversight that works. So today we're going to be talking about a case of a 27-year-old nurse with chronic pain. Chronic pain because she was changing the diaper of a total care patient when she strained her left neck, shoulder, trapezius area. She has no pertinent comorbidities, so there's nothing in her chart that says she's got depression, anxiety, or any type of medical condition that would amplify her pain. So her treatment started in the traditional form, which is to give some type of pain relief, whether it's Tylenol or ibuprofen. She was given work restrictions not to lift more than 20 pounds, and she was also referred to physical therapy. Well, a week later, she comes back into clinic and she says her condition really hasn't improved, and now she's got numbness and tingling in her left pinky finger and her left ring finger. An EMG, or a nerve conduction study, is ordered for her upper extremities, and an MRI of her neck is also ordered. The nerve conduction study came back normal, which showed all of the nerves in her neck and her arms and her hands was completely normal, and the MRI of her neck also came back completely normal. On physical exam, she had full range of motion of her neck, full range of motion of her arms and shoulders. Only thing that was noted was subjective tenderness when you pressed on certain parts of her neck or shoulder. When it got time to explain to the patient that, hey, structurally, we don't see anything wrong with your neck, we don't see anything wrong with your shoulders, she was not willing to accept that answer. And the part of the conversation that kept coming back around is, but I have this pain, but I have this numbness. What's wrong? I didn't have it before. So we began this conversation about chronic pain. And I wanted to share this with you that sometimes when a person has been experiencing pain for so long, the signals for pain stop coming from the actual tissue and they start coming from the brain. So a good example is a person who has had an amputation of their leg. So we've all heard of phantom pain, right? The leg is gone, but the person still feels pain in the leg that is no longer present. The pain is not coming from their leg, right? Because the leg is not there anymore. The pain or the signal for pain is coming from the person's brain. And so the same thing can be seen in patients like this who've had a very simple muscle strain that should be resolved within 2 to 3 weeks, but for whatever reason, the pain signal continues to be generated 3, 4, 5 months down the road. So what a lot of practitioners will do is they'll send the person to pain management, and pain management will start doing injections, or pain management will prescribe all sorts of drugs to include opioids. And what I found in my practice is that typically does not end well. The claim just stays open forever because we are on this cycle of trying to chase complete pain relief. One of the things I've started doing in my practice is instead of sending patients to a pain management doctor, sending them to a pain therapist, which is very different. Pain therapists are psychologists and they teach patients how to turn off the pain signal that their brain is generating erroneously. It's like a false alarm. There's nothing structurally wrong with the tissue, and teaching the person, how can I turn off those pain signals so that I can regain my normal life, right? So if you've got claims that have not closed in eons, and as you're going through the records, the only thing that you can see is that the patient continues to complain of pain, despite there not being anything structurally wrong. This may be a good strategy for you to use. There was a randomized controlled trial published in JAMA, which is the Journal of the American Medical Association, and it looked at pain reprocessing therapy compared to placebo compared to receiving traditional treatment. And in the study, they found that those patients with chronic low back pain who received pain reprocessing therapy had much lower pain scores at the end of the study. And randomized controlled trials are the highest level of research evidence that we have. They're considered the gold standard. And I'm actually going to link that article in the description of this video because pain reprocessing therapy not only works with chronic low back pain, it works with neck pain, it works with any type of pain that a person is feeling inside of their body. I'm also going to be linking a video in the show notes giving you a demonstration of what that looks like and how powerful it is, so that as you're going through claims and you think this is something that your patients could benefit from, you can find a pain therapist in your area who takes workers' compensation and talk to the doctors who care for your injured workers to work on getting the patient referred over to a pain therapist. So if you'd like to learn more helpful strategies to help you resolve your claims faster, sign up for our email list at ascendachmed.com, where every week we send out helpful information that will change the trajectory of your claims. Until next time, peace.